Hello, my name is Rachel McClements and I am the Chief Operating Officer here at 5 Acres. Today we're going to be talking about caring for the COVID-19 positive child. We're going to be talking about what COVID is, how to recognize symptoms, how to prevent it, how to care for a COVID-19 positive child, and then recovery. And within recovery, we're going to be talking about multi-system inflammatory syndrome in children. It's a very important syndrome for us all to be aware of. It's relatively new, it's very rare, and it can be potentially life-threatening. So let's start by talking about COVID-19, and you have heard about it. It's in the news all the time. There is a global pandemic after all. What is it? Well, it's a coronavirus, and coronaviruses, as you may or may not know, are a large family of viruses, and they can cause diseases in both humans and animals. And in humans, there are several coronaviruses that currently exist, from the common cold to MERS to SARS. And the most recently discovered one is COVID-19. And as you know, that was discovered recently in Wuhan, China in December of 2019. And that's why it has the 19 at the end. It's now a pandemic affecting many countries globally. It's an infectious newly discovered disease, and it spreads through droplets of saliva or discharge from the nose of an infected person. Interestingly, it's possible to become infected and spread COVID-19 and show absolutely no symptoms at all. And those individuals are typically referred to as being asymptomatic. Now, we're going to focus this presentation on children, and for the most part, most children experience very mild to moderate symptoms, and they don't require any kind of specialized treatment. Let's turn our attention, first of all, to prevention. So, how can we reduce our chances of being infected and spreading COVID-19? And we can do that by taking some very simple precautions. And over the following pages, we're going to list some of those suggested preventative measures for yourself and your family members. But remember that the situation with COVID-19 is pretty unpredictable. And so we're going to advise you to check in regularly with the World Health Organization, the CDC, your local public health authority, because research is always coming out now, and there are going to be updates all the time. The information that you'll hear in this presentation is correct as of the time of this presentation. So the first thing that we want to do to prevent the spread of this disease is to wash our hands often. We want to make sure that if we have soap and water, that we thoroughly wash them and clean them for about 20 seconds. And if you're wondering how long is 20 seconds, that is about the length of time to sing happy birthday twice. You want to make sure that you wash them, especially if you've been in a public place, or blowing your nose or coughing or sneezing, or before you prepare food, or certainly before you touch your face. If soap and water are not available, then know that you can use a hand sanitizer, and you want to make sure that that hand sanitizer has at least 60% alcohol in it. Make sure that you cover all the surfaces of your hand, including your nails, and make sure that you rub them together until they're completely dry. Finally, you really want to make sure that you avoid touching your eyes, your nose, your mouth with any unwashed hands. Remember that contaminated hands can transfer that virus to you via your eyes, your nose, or mouth, or through any mucous membrane. Okay, so prevention again, let's talk about practicing social distancing. We want to maintain here in the US a distance of at least 6 feet, and that's about 2 arms length from people outside your home. So this is a disease that spreads when somebody coughs or sneezes or even talks. They spray very small liquid droplets from their nose and their mouth. If you're too close, then you can breathe those droplets in. And if that person has got COVID-19, you're going to be breathing in the virus. Remember that there are some people who are completely asymptomatic, and they can still spread the disease. That means that they don't know, or indeed are not showing any symptoms of COVID-19, but they have it in their system and they can spread it. So keeping your distance from people is especially important in terms of prevention. Another way to prevent catching this disease is wearing a mask when you're around others. You need to remember to cover your mouth and your nose with a mask. You also as well want to remember that, again, this is a disease that's being spread through respiration and through those droplets. So what the mask will do is it will catch some of your droplets into the mask and protect other people that you're talking to. But it's also as well going to protect you if you're talking to somebody who is breathing out and releasing those droplets into the air. They're going to fall on your mask and not become inhaled by you. You really want to make sure that you're wearing a mask in public settings, and especially when you're around people that you don't live with. I know that sometimes social distancing is very hard to maintain, so you want to make sure that you're wearing your mask in those situations. Also as well, following good respiratory hygiene is really important. What does that mean? Well, remember that these droplets spread the virus, and by following good respiratory hygiene, you're going to protect not only yourself, but also as well the people around you. Make sure that you cover your nose and your mouth with a tissue when you cough or sneeze, or if you don't have a tissue around you, then you want to sneeze into or cough into your elbow. Throw those tissues into the trash and immediately wash your hands with soap and water for at least 20 seconds after disposal of that tissue. Cleaning and disinfectant is very important. Even though we know that COVID-19 transmission is more likely to occur from person to person, evidence is showing that the virus can remain viable on surfaces from hours to days, depending on the type of surface. So you want to make sure that those high touch areas like tables, doorknobs, light switches, countertops, etc., are going to be cleaned regularly. If they're dirty, you can just clean them with regular detergent, soap and water, and you can also as well use an EPA registered household disinfectant. Finally, one of the best things that you can do is to monitor your own health daily. Be alert for these symptoms, and we're going to talk about what those symptoms are in a little bit. But you want to watch for signs of a fever or a cough or shortness of breath within yourself, especially if you're out and about and mixing with other people. You want to maybe take your temperature if symptoms do develop. And remember that when you do take a temperature, if you've been running around or exercising, your temperature is likely to be elevated. So give yourself some time before you actually take that reading. The same is true if you've taken Tylenol or acetaminophen. That's going to lower your temperature a little bit. So again, bear that in mind if you're temperature taking. And then finally, letting you know that really it's good practice to follow CDC guidance and to check in with the CDC website on a regular basis, because it's always being updated, especially where this virus is concerned. So let's turn our attention now to symptoms of COVID-19 in children. And first of all, let's talk about how long it takes for symptoms to develop, if they're going to develop. Pretty much the time between exposure to COVID-19 and the moment when symptoms start to occur is commonly around about 5 to 6 days, but it can range anywhere from 1 day to 14 days. So let's focus now on children. We're aware that although children of all ages can become sick with COVID-19, most children infected typically don't become as sick as adults do. Some children who have an active infection with the virus that causes COVID-19 don't even show any symptoms at all. And remember, those individuals are called asymptomatic. So it's quite possible for children to show really mild symptoms, and some of them don't even show any symptoms at all. Now, the under 2s do tend to have much more severe illness with COVID-19 than older children. And research thinks that that might be more likely because they have immature immune systems and smaller airways. But again, the research is always altering on that. So what are the typical symptoms? Well, the typical symptoms in children are very similar to those symptoms that are found in adults. COVID-19 is a disease that affects different people in different ways, and it not only affects them in different ways, it also affects people in severity, from mild symptoms to very severe illness. Remember, children typically have milder symptoms, but the symptoms that they can experience are things like a sore throat, a runny nose, fever or chills. Sometimes they might have muscle pain or complain of a headache. Loss of taste or smell is a very interesting one, and it appears to be quite unique to COVID-19, as is nausea and vomiting, diarrhea, and just general tiredness. So those are some of the symptoms that a child might experience as they start to come down with this disease. So what are you going to do if you suspect that your child has COVID-19? We're going to advise that you call your child's doctor or nurse or healthcare facility, who's going to advise you if your child needs to be tested for COVID-19. So your child has tested positive. There's a lot of anxiety about that and worry. And depending on the age and the developmental stage of your child, they may be showing symptoms of anxiety and worry about being diagnosed with this. So what can you do to help? Well, one of the most important things is for you to remain calm. Remember that children react to both what you say and how you say it. They pick up on cues from the conversations you have with them and with others. You want to reassure them that they're going to be safe. We hear very scary things in the news, and children need to be reassured. Let them know that it's okay to, if they feel upset. Share with them how you deal with your own stresses so that they can learn how to cope from you. And make yourself available to just listen and to talk to them. Let them know that they can come to you with any kind of questions. You also as well maybe want to watch and monitor what your child is, or what children are seeing and hearing on TV or online. You might even want to think about reducing some of the screen time focused on COVID-19, especially if that's leading to their anxiety. And you could even talk to them about how some stories on the internet and social media can be based on rumors or even inaccurate information. Sometimes children can misinterpret what they hear, and they can be very frightened about the things that they don't understand. So for you as an adult around a child, your job is really to keep calm yourself, to help them to understand, and to really just to be able to talk with them. How about the physical care, though, for children with, who have been diagnosed as positive? If it's possible in your home, you want to have the child stay in a bedroom and use a bathroom that's separate from other people in the house. And we're aware that that is not always possible, but trying to restrict the shared usage of space is something that you want to do as much as possible. If it's possible, use separate bedding and towels, and don't share them with other household members. So be able to give the child their own towel to use, their own bedding to use. You also as well want to make sure that any shared spaces have got good airflow. You can avoid open windows up. You can turn on an air filter or an air conditioner if you have one. And then you want to also as well avoid or limit the number of visitors in your home. Remember, you're protecting other people as much as your child. When you're working with the child, or when you're with your child, you can encourage their child to wear a face mask when they're around other people. Face coverings really ideally are only for individuals, for people who are older than 2 years old. Anyone under 2 years old, it's just not advised for that child to wear a face mask. And also as well, not for anybody who does have problems breathing. And I'm going to also as well say that a child should never be left alone wearing a face mask. If the person who is sick, for whatever reason, can't wear one, for whatever reason, caregivers should always wear one when they're in their presence. So if your child, for whatever reason, cannot wear one, either behaviorally or physically, then you want to make sure that you always have your mask on when you're in the same room as them. You're going to want to wear gloves when you touch or have contact with the child's blood or stool or body fluids such as saliva, mucus, vomit, and urine. throw those gloves out into a lined trash can. If you're in a facility, you can utilize a biohazard container, but otherwise you're going to put them into a lined trash can. And remember to wash your hands right away, especially for 20 seconds. And remember that you also as well want to put those gloves into a separate area, so put them into a lined trash can. To prevent getting sick yourself, make sure you practice everyday preventative actions. And we've already talked about those. You're still going to do them. You're going to clean your hands often. You're going to avoid touching your face, your eyes, your nose, your mouth with unwashed hands. And you're going to be cleaning and disinfecting surfaces often. If your child happens to have symptoms that include things like coughs and sneezes, you want to encourage them to sneeze or cough into a tissue and throw that tissue away straight away. If it's possible, you then want to encourage your child to wash their hands straight away afterwards, again for 20 seconds, or alternatively, you can give them some alcohol-based hand sanitizer and have them rub it into their hands as well. Remember, if they've handed you a dirty tissue, you want to make sure that you wash your hands after you've helped your child every single time. Finally, you also as well, talking about the household, you want to use a household cleaner and wipe and clean things that get touched a lot. And we've already talked about this under preventative measures, but these are going to be true when you're caring for a child who's COVID positive. You want to make sure that you're cleaning doorknobs, light switches, remote control, etc., and even phones. If it's possible, try to keep a sick child's toys separate from other toys in the household. If you have more than one child in the house, maybe have some toys that are for just the sick child so that you're not risking infection from toy to toy. And then you're going to be washing the child's clothing and bedding and towels with detergent in the hottest possible temperature that your machine will allow. If you can, wear gloves while handling their laundry. And always wash your hands afterwards. And then for food and meal times, if you can use separate dishes and glasses and cups and maybe just allocate those for the sick child, or indeed use paper plates and paper products, you're going to want to do that and not share them with household members. And then remember that when you do wash up, to wash them with really hot soapy water, or put them on the hottest cycle of the dishwasher. So we've talked a little bit about physical issues when the child is sick, and also as well a little bit about mental issues. But, you know, being sick with COVID-19, especially if the symptoms are very mild or they're asymptomatic, is really lonely and potentially boring for children. They're kept in a separate space. They're not able to do a lot of what they were doing before. So know that your child is probably going to be very bored after a while. They're also as well separated from their friends, from their classmates, from other family members, from other people that they would normally interact with. If it's possible, try to find a way for the child to be able to talk with family, with friends, with their peer group on the phone, or doing a video chat, using a computer, using your iPhone, using your phone, however you're going to do that. Allow them to text or use apps to be able to talk with family and friends. Maybe they would want to play online games with those individuals as well. There's a lot of games now where you can interact on your phone and somebody else is playing the game with you and you're not even in the same room. And then always the more traditional things like puzzles and Legos, drawing, playing with toys, and indeed watching movies. So lots of things, but bear in mind that it does get pretty boring, especially if you're not feeling very ill. So we've gone through the child who is positive. We've gone through caring for that child, and the child is on their way to recovery and has recovered. They're back living with everybody else. They're back to normality. The symptoms have passed. And we're going to talk now and turn our attention to something called multisystem inflammatory syndrome in children. It's also called MIS-C for short. What is it? Well, it's a newly recognized rare and serious condition called multisystem inflammatory syndrome in children that is linked to COVID-19. It's a complex post-COVID-19 spectrum of illness that has affected a very small number of children and adolescents. At its core, it's a hyper-inflammatory response that we don't yet fully understand. It's very new. And some children who do get this get rapidly worse to the point where their lives are actually at risk and danger. And so we want to educate you on this syndrome today. Much is still to be learned about it, but if your child shows any signs or symptoms, you want to make sure that you get help fast. Okay, so when does MIS-C appear? Well, because the illness is so new, information and symptoms are still being documented, and they're going to vary from child to child. But it appears that in children who have tested positive for COVID, or indeed have been exposed to COVID within the past 4 weeks, although it should be noted that neither is necessary to make a diagnosis, the main thing to watch for is a persistent fever lasting more than 24 hours. It's usually present for several days, and the child begins to appear very fatigued, very ill, loss of appetite, not drinking enough fluids. Symptoms, however, can worsen really quickly. So seeking timely medical intervention is really important if you see anything concerning. So we're talking about this time frame once the child has recovered from COVID-19 of about this 4-week period, although I'm going to say that this is still very new and the research is still being put out there on this. But around about a month afterwards, there is this syndrome that can appear that can be very life-threatening to the child. Researchers are suspecting that this is caused by a delayed immune response to the coronavirus, that somehow the body goes into overdrive and it causes this inflammation that begins to damage multiple organs. Experts believe that the virus triggers this immune dysregulation and hyperinflammation. Now, most children with MIS-C appear to have been previously healthy. So this is the child who was, they were diagnosed with COVID-19, had very mild symptoms, they've recovered nicely, they appear to be really healthy, and they've had very few of those COVID-19 symptoms, and then they develop this syndrome. So it's important, though, to remember that overall children fare very well with COVID-19 compared to adults. And it's also as well important to remember that only a small fraction of children seem to develop signs and symptoms of MIS-C, and most of them have recovered quickly. However, it is a very serious syndrome, and so we want to make sure that we're well versed and being able to look out for it, especially for a child who has had a good recovery to COVID-19. Okay, so here's the official diagnosis of what it is. It impacts an individual aged under 21 years who presents with a fever, laboratory evidence of inflammation, and evidence of clinically severe illness requiring hospitalization with multi-systems, more than 2, organ involvement. For example, your cardiac system, renal, respiratory, hematological, gastrointestinal, skin, neurological, and there's no other plausible diagnosis, and this child was positive for COVID-19 within the 4-week prior onset of these symptoms. Okay, that's a lot. So let's break that down. What does that actually mean? How can we look at it in layman's terms? It's a really serious condition in which some parts of the body, the heart, the blood vessels, kidneys, digestive system, brain, skin, or eyes can become inflamed. Inflammation typically includes swelling, and that's often shown with redness and pain. Now, most children who develop MIS-C test negative for a current infection with COVID-19. They don't have COVID-19 anymore. They've had it in the past. They don't have it currently. Most of them don't test positive for it, and yet they're having this syndrome. So what are some of the symptoms that we can look out for? How do we know when to seek medical help? If the child has a fever of over 38 Celsius or 100 Fahrenheit or greater for more than 24 hours. If the child suddenly begins to become fatigued, they begin to vomit, they have diarrhea, they develop a skin rash. So think about this is an inflammatory disease. So suddenly seeing a skin rash, neck pain, red eye, sometimes redness or swelling of the lips and the tongue, or even of the extremities of the hands and the feet, and any other symptoms that might involve multiple organs. So if you see any of this, you want to seek medical help. Now, there are times when some children begin to decompensate very, very quickly, and you're going to be calling 911 for any of the following symptoms. If your child is unable to wake up or stay awake, if your child in any way has difficulty breathing, if there is chest pain or pressure that doesn't go away, or your child is newly confused, bluish in their lips or their face, or severe stomach pain, you're going to be calling 911. All right, I'm going to repeat that for emergency care. I want you to contact your child's doctor, nurse, clinic, healthcare facility if your child is showing any symptoms of MIS-C. And if they're showing any emergency warning signs, such as trouble breathing, pain or pressure in the chest that doesn't go away, new confusion, inability to stay awake or to wake up, bluish lips or face, or severe abdominal pain, calling 911 and going to your local emergency room. When you arrive, you really want to let that healthcare worker know that the child was tested positive for COVID-19 in the past. Remember that also as well that some children who have tested may not have tested positive for COVID-19. The child may have been asymptomatic. So this is really important for us to be aware of as a disease that is going on while we're in this pandemic. So what about treatment? Well, children who have this need very close observation. Most children who come down with this need to be treated in a hospital, and some of them are going to be treated in a pediatric intensive care unit. The treatments really include therapies that are targeting the immune system and reducing that inflammation. And the doctor is going to look to do certain tests to be able to look for inflammation or other signs of disease. So they're potentially going to be doing blood tests, they're going to be doing chest x-rays, ultrasounds, and abdominal ultrasounds as well. Okay, it's possible as well, given that very often MIS-C comes with cardiac involvement, that the center or the healthcare clinic or the emergency room is going to be doing some baseline cardiac testing. And those are some of the other tests that they may very well do with your child. So I'm going to end after we have just educated you all on this syndrome, is letting you know that overall, remember that children fare so much better with COVID-19 compared to adults. Their symptoms do tend to be quite mild in comparison. And remember that only a very, very small number of children seem to develop signs and symptoms of MIS-C, and most have recovered very quickly. But now you have heard this presentation and you are more educated about what to look for this very new rare syndrome that has been evolving. And I hope that it was really informative for you. And that is the end of this presentation. So I'm going to end my slideshow and I'm going to stop recording, and I'm going to wish you all the best. And if you have any questions at all, please feel free to reach out to me.